Greetings, everyone. Welcome to this edition of 55 Plus, the perfect years. Let's see what's new first in the 55 Plus community. And then in a little bit, we've got an interview with Hugo Santana. We're going to talk about Social Security and Medicare briefly. So I hope you can stay with us. But first, let me tell you what we're going to talk about here is a little bit of news that's going to potentially affect you and me. Okay. So the first question that I want to ask is how old is considered old? Well, here's an interesting article published by NBC News, written by Aria Bendix and Katie Mogg. The answer to that question appears to be changing as people live longer, retire later, and maintain higher levels of physical and mental health into their older years. A study suggests that people in their mid 60s believe that old age starts at 75, but the older people get the later they think it begins. The research published in the American Psychology Association Psychology and Aging Journal examined data from around 1,400 participants in the German Aging Survey, which studies old age as a stage of life in Germany. The participants were born between the year 1911 and 1974 and entered the survey at the age of 40 to 85. The people studied reported their perceptions of old age up to 8 times over 25 years. For every 4 to 5 years that passed, participants reported that old age started a year later compared to the last assessment. Participants who were born earlier from 1911 to 1935 thought that old age started earlier compared with the participants born after 35. Our perceptions or conceptions of old age are obviously shifting across historical times. People nowadays who are in midlife or who are older adults believe that old age begins later than it did during the period 10 or 20 years ago. Marcus Weinstein, the study lead author and psychologist at Humboldt University in Berlin, said the exchange could be due to part the increase in life expectancy. German life expectancy is around 81 years at birth, up to 71 years or it was actually up from 71 years in 1974. Many people in Germany are also living healthier lives for a longer life. Studies have shown improvements in heart, cognitive abilities, and overall quality of life in the country's older population over time. People who feel younger also believe that old age starts later, Weinstein said. Participants in the study who were lonelier had more chronic diseases or reported being in poorer health and were more likely to believe that old age started earlier. Women, on average, thought that old age started around 2.4 years later than men did. However, Jackie Smith, a psychology professor at the University of Michigan, who is not involved in the research, cautioned that the results may not apply to other countries since cultural views of aging and historical trends vary between communities. In the United States, for example, life expectancy declined during the COVID pandemic from 79 years in 19, or actually, I should say 2019 to 76 in 2021. So that was a drop of about 3 years, whereas Germany's life expectancy actually has been fairly consistent since 2014. So there's something to ponder. How old do you consider old? If you want to let us know, well, you can leave us a note at 55 plus, the perfect years at gmail.com. And speaking of old, this year, 2024 is expected to be a record-breaking year for retirement in the U.S. An average of 11,000 Americans a day are expected to celebrate their 65th birthday from now until December. So, what does this mean? Approximately 4.1 million boomers will be celebrating their 65th year, and every year through 2027, according to Alliance for Lifetime Income. This event has been called Peak 75, or actually, I should say Peak 65, or the Silver Tsunami. and it is the biggest surge of retirement age baby boomers in history. With this surge, these new 65-year-olds will have to navigate their way enrolling in Medicare and soon in Social Security. And this can be rather daunting and confusing to many. So, with that in mind, I've invited Hugo Santana of A&A Financial to join us. Hugo is an insurance broker who specializes in Medicaid and Medicare. He is joining us via our interview here, and hopefully we can get him here online. This is the first time we're trying to add him on here. So here we go, Hugo. Thank you and welcome to our podcast, 55 Plus, The Perfect Years. How are you doing today?
Really good, really good. How about you, Mr. Roy?
I'm doing well, and I really do appreciate you joining us today because I think this is something that's very important. You and I deal with these issues on a daily basis. People turning 65, people that are wanting to register for Medicare. But more importantly, let's first of all start with the fact that people, and they don't know that people can actually start claiming their Social Security at a younger age, correct?
Yes, there is some types of requirements that Social Security will allow you to require to get that. So there is several.
And I believe some people can, and we're going to talk about it after our interview because I've got some issues that I need to discuss also with the listeners that they can start at 62, but they can wait till 70 or plus. Let's talk about Medicare because that's one of the things that is very important, and more every day it becomes more important for people. Can you walk us through the process of actually registering for Medicare?
Sure. There's a couple of ways you register for Medicare. Some automatically register for Medicare. The Social Security office will send you the information through a mail. You qualify for Medicare. They do certain items, and also you can walk into Social Security office and do it. You can go to sss.gov also and register there for Medicare. So there's various ways you can register for Medicare. Again, it's a long process, very hard understanding. Um, if you don't do this, I mean, of course, there's not a book that I can provide you to tell you step by step process, and this is the way you do it. That's the biggest downfall our seniors have, that nobody's out there to educate our seniors for Medicare. Um, so many questions, so many answers. You go to the office and they tell you something, and then you go to the phone and they tell you something totally different. It's like that all the time, so it can be very very confusing.
So, somebody wants to enroll in Medicare, can they call you?
Yes, they can call me.
And
They
how
can
can
call
they
me
get
and
in
I
touch
can.
with you?
They can call me on my phone. They can email me. There's different ways of Facebook. There's also a website that I have. But the main resource that everybody does is call 956-516-3630 is my phone number. And they can call me. We can sit down and discuss it. No obligations. There's nothing. There's no fee for applying for Medicare. There's no fee for the appointment. It's educational. Um, it's more education for the client.
And then what are the options once you have successfully? Because it's not going to happen overnight, right? There's a
Oh,
window that they need to register for Medicare for Part A and then Part B, and then maybe even Part D. But down here in South Texas, most of the people that are on a Medicare plan, they're typically on a Medicare Advantage plan, aren't they?
Well, at the very beginning, it really depends. Um, there's some supplementals, there's some Part Ds, there's some Part Cs out there. Medicare Advantage is a Part C. Part D is a prescription drug plan, and then again, Part A is the qualification one, the hospital, which if you have the 40 credit hours, automatically you earn that because, of course, you paid into it. And then the Part B is the one you also can apply for. You can opt in or opt out of Part B. There is right now for this year there is a fee of 174.20 per month. Uh, so there is different options for those
But
particular Medicare.
technically speaking, most people will go ahead and apply for Part B, even though they're not required, correct? But they can get penalized if they don't register for them, can't they?
Exactly. You do get penalized for not registering for Part B. It's registering for a Part D prescription drug plan. So you can qualify for Part A, of course. Part A you paid into it, so automatically qualify for it depending on the credit hours. Those are the hours worked. For the required minimum is 40 credit hours, so that is about 10 years of work, consistent work. Um, I mean, it can be 25 years and you barely hit the 40 credits, but depending on what quarters and it's if you go down the Social Security website,
You
it's a
have to
lot of
earn
information.
you have to earn a certain amount of money in order to be able to basically qualify.
Yes, but also it's the amount of money that you qualify is the amount of money that you're going to get back. But the quarters are the ones that will give you for every quarter of the year you get one credit. So for
Right.
every year there's four credits. So that's why they say 10 years of work is 40 credits. But if you work one credit, one quarter, 1 year, you just earned one credit. So that you can work only one credit for 40 years and you still qualify for Social Security for the Part A. So it's complicated. I mean, there's a lot of little. Uh,
Then there was some talk about being able to buy in, but it seems like you can't really buy in for those credits. You either got to work them or you're not going to get them, and that's the bottom line.
yes, and there is some option to buy in. It's just pretty pricey to buy in. But again, how many credits do you need? There's different way. Every client is very different, so we really need to sit down with them and talk to them and find out what the status is with their Medicare.
So if somebody's getting ready to reach 65, if they've got 3 months before they can reach the age of 65, then start registering, or they've got as late as 3 months after they reach the age of 65. But it does take a little while to get that Medicare number. And you, as an insurance broker, you can't do anything for these people unless you have that Medicare number, correct?
Well, yes, there is. You're absolutely right. Without the Medicare number, you really can't apply for Part B because Part A is the one that's given to you, so you qualify for that. So that's a portion of work and contribution into the system. That's the way you qualify. So, and then Part B is optional. You can purchase it or not purchase it, but you would need to purchase a drug plan if you qualify for Part A. You will need a drug plan so you can avoid the penalty, credible coverage penalty.
Right.
Um,
And that penalty, just in case, so if people are wondering, oh, I think I can wait and not register, that penalty stays with you for the rest of your life. That's
that
the
is
sad part
correct.
about it.
That is
So
correct.
once again, Hugo, if somebody needs some help, give us your number and how we can reach you so that they can call you, set up an appointment, and at no cost, you can sit down and talk to them and get them up and running.
Yes, exactly. So 956-516-3630. And my phone number again is 956-516-3630 is my phone number. And we're here to set up appointments, and we're here at the office. I mean, we have an office in McAllen. So we have two offices in McAllen. So we're here to help you.
Again, Hugo Santana, A&A Financial, ready to help you as you turn 65. And again, Hugo, thank you so much for joining
No,
us.
not a problem.
And we'll bring you back somewhere along the line and talk more about some of the plans that are out there that might benefit people.
Okay, not a problem.
All right.
All
I
right.
appreciate it. Thank you again.
Thank you,
Thanks
Mr.
for
Roy.
joining us.
We'll talk later.
All right. Take care.
All right. All right.
Well, there you have it, folks. That's how you do the Medicare registration. You don't have to do it on your own. Seek out somebody like Hugo Santana to help you with it. He doesn't charge you for it, and then he can help you walk the rest of the process. So we really do hope that this has been very helpful to you. So here at 55 Plus, this is your go-to podcast for navigating the joys and challenges of retirement today. So today we've been diving into this topic of registering for Social Security and for Medicare. And speaking of Social Security, I want to explore the pros and cons, because you do know, or you may be aware, that you can start claiming Social Security if you've got enough hours and enough credits. You can start claiming Social Security as early as 62 years old. The typical retirement age is 66 and a half, and that's for those that were born before 1957, and it's going to move up a little bit. So you can also delay the benefits. You can delay the benefits until you're 70 years old, and what happens at that point is you're going to get a little bit more money. So let's talk about taking Social Security early at age 62. The primary advantage is that you get to start receiving the money and the benefits sooner, providing that, it's going to provide you a steady stream of income to support your retirement lifestyle. However, it's essential to consider the downside. By taking the benefits early, your monthly payments will be permanently reduced compared to what you would receive at that full retirement age. Plus, if you continue work while you're receiving the benefits, you may be subject to the earnings limit, which could further reduce your benefits. And right now, that earnings limit is about $22,000. It's a little bit over $22,000, and you can get that when you talk to Social Security. Now, let's discuss waiting until full retirement, which in most cases of the baby boomers, it's going to be 66 years plus 6 months for those born in 1957 or earlier. The benefit of waiting is that you'll receive your full unreduced Social Security benefits, allowing you to maximize your monthly payments. Additionally, you will not be subject to the earnings limit, so you can continue working if you want to, and you're not going to be impacting your benefits, and you're not going to be impacting your earning power. So you can be getting both if you so desire. However, the downside to that, of course, is that you have to wait a little bit longer to start receiving the benefits, which may not be feasible for everyone, because it all depends on their financial situation and their retirement plans. Finally, let's talk about delaying Social Security until the age of 70. By doing so, you can earn delayed retirement credits, which can significantly increase your monthly benefits. For every year you delay past the full retirement age, your monthly benefits increase by about 8% up until the age of 70 years old. This can be a smart strategy for those who can afford to wait and want to maximize their Social Security income for the rest of their lives. The only downside, of course, is you got to weigh, how your health is, and do you expect to live to the fullest your life expectancy? That's the other aspect, and that's what you have to weigh. So each one is an individual basis, and you have to make those decisions, which works best for you. That wraps up our discussion on the pros and cons of taking Social Security early at 62, waiting until full retirement age, or delaying the benefits until age 70. If you want more, you go to socialsecurity.gov or drop us a note, drop us an email. You can drop us an email at 55 plus the perfect years at gmail.com. That's 55 plus the perfect years at gmail.com. On our next episode of 55 plus the perfect years, besides the news for 55 plus community, we want to explore travel and making life better for those living with the challenges of limited physical abilities. Because it doesn't mean if you have limited abilities, or what people like to call disabilities, I prefer to use limited abilities, that you have to just stay home and not travel. We're going to talk to an expert that is involved with a company called abilities.com, and they have expos throughout the country, and you're able to see all of the different things that can benefit you and maybe help you as you get older. Okay, so we do want you to join us on our next episode next week. Hope you join us then. And as we like to say, getting old is better than the alternative. And it's a privilege many do not get to enjoy. Stay safe, and we'll see you next week on 55 Plus, the perfect years. Thank you.